Our microground continues for the next 2 hours. We're here discussing budget matters. Of course, in the previous hour, we're having conversation with Alex and Rono from Budgeti Hub, from the Institute for Social Accountability. Now we have an audience gathered from Nakuru County, and they're here. Say good morning, people. Say good morning, fixers. Good morning. Asante sana. These are our fixers. We'll be having conversation with them. Among them, well, we'll hear from Joy Kamau Toroitich, who's the CEO for Better Lives in Nakuru, Nimo Mohamud, who is the Director of Finance at Egerton University, Dennis Rollins Ouma, who's a student leader at Technical University of Kenya and a member of the National Students Caucus. We'll also be hearing from Franklin Pesa, who's the Director of Academics, Egerton University, who's also very, very passionate about education reforms, economic and finance for students. So we'll have the conversation first about the budget and the expectations for the next financial year's budget. And in the next hour, then we move this conversation into education. It has been a big and thorny issue. I want to start the conversation by just giving the mic to Joy Kamau, Better Lives in Nakuru. Joy, from what you deal with and the things that you do as Better Lives in Nakuru, first you'll tell people what Better Lives in Nakuru is. And does it mean that you give people better lives? Does it mean that everybody who's not with your organization is not having a better life? Oh, anyway, what is Better Lives?
Thank you, Eric Latif. My name is Joy Kamau Toroitich, as mentioned. Better Lives is a women-led organization based in Nakuru, and we focus on education, health, and gender equality. And Better Lives comes from just improving lives. We are here to improve lives. Budgets are about individuals, but when it comes to education, we advocate for girls' education. We know that education is really the true equalizer. Even if you come from Lokichogio or you come from Nairobi, so long as you're able to access education, or even Rongai here in Nakuru, if you can access education, quality education, just like the child in Nairobi, you'll be able to actually move steps, unlike if you're not educated. And when it comes to education, at Better Lives, we advocate for actually students to be able to access funds to go to school. And those are just among the few things we do.
Okay,
yeah.
So we'll come into this conversation even as we hear from the others on the matters of what we do with our social sector. But let's come into our first part of budget. You just heard from what we're saying with Alex and Rono previously about citizens' engagement and understanding on matters of budget. As we get to these penultimate stages of our budget-making process for the next financial year, from your engagement with the citizens of Nakuru, and we'll pass on the mic, do you feel that as we're getting into this point where Parliament is discussing our budget, you know what's contained in the budget, you know the numbers, you know the money that's coming to various sectors that affect you? Are there areas that you feel that this money will benefit us? Are there areas that you feel that money will not benefit us? Starting with you, Joy.
Okay, thank you. First of all, I would like to state just bluntly that it's really not a Mwananchi budget as much. When it comes to let me just stick with education. When it comes to the capitation, it's hardly enough, and it has been reducing. We are being taxed as citizens more, but the capitation given to the students, I remember a while ago it would be around 22, and then it came to around 17,000. When I say 22 for the people in high school, and then it came to 17,000. Essentially, this means that as a parent who is supporting girls in education, I have to dig deeper. And I feel like the education should be fully funded, actually. And time by and by, we have been talking about why does the government, you tax us, we give you money, and then again we have to come and queue in lines to look for bursaries.
To
beg for that money, and you take photos of our children. As you give us our own money that we give you, or probably was borrowed from somewhere, the budget should actually be looked at in totality.
Yeah.
Our children, let me just take this in Kiswahili.
That's education. We'll talk about education in the next hour in greater detail.
Yeah.
In the other areas, the social areas, so we know that there's health, we know that there's social protection, there's children protection, there are so many other areas. Do you feel that the citizen is at the heart of these budgets?
Not really. Not really. You've just mentioned social protection. why are our women not safe? Every day we are seeing a woman in Nakuru or a woman security. Like this week we've seen people being shot in Nakuru, like I think one person in London. We are not paying our taxes for our citizens to be shot. There are better ways of just like if the policeman had a better way of dealing with that. For example, what I mean is that the taxes should be used appropriately, whereby you prioritize. Like if I go to hospital, let me get medicine. I do not have again, I get the consultation and I have to go again back to my pocket because there is no medicine there. If I am a citizen, I'm on the street, I want to walk around and probably riot. You don't misuse the bullet simply because you have it. And as a woman, I should feel safe. The police should be there to secure me, not again to shoot me. So I feel like the budget is there, but it's being misused. The money is not being used appropriately. And that could explain why we have an over expenditure. We are spending more than we are budgeting for.
Thank you. Yeah. Mariam, you had promised to tell us how many grains of rice are in a spoonful into a plate.
Yes.
And then you juxtapose that between grains of rice and 4.29 trillion shillings budget.
Right. So let's start with the grains of rice in a spoon. 1 tablespoon. I know it sounds like a lot.
Tablespoon ni kijiko ya kawaida.
Nile kubwa.
Okay.
Aya. Hiyo inakuanga about 7,000. I know.
Wow.
I know.
That's not serving spoon.
No, tablespoon. A heaped tablespoon.
Okay.
When you think about it from, for example, a football field, you would need 1 trillion grains of rice to fill a football field. So when you think of our budget as being 4.2 trillion, think of 4 football fields end to end covered in rice.
That's our budget.
That's our budget. I just to give you perspective, how long would it take you to eat that much rice? You couldn't in your lifetime probably eat that much rice. It's good to juxtapose these things because when we give them analogies that we can imagine, now it starts to get real. Otherwise the numbers just go over your head. But I wanted to ask the audience, these numbers, what do they mean to you from your understanding of this year's budget, this year's finance bill? Is there anything that has stuck out to you? Anything that you are happy about? Anything that you are particularly unhappy about? And do these numbers make sense to you when you hear the billions, the trillions, or do they just go over your head and you're like, that's a bit much for me? But I wanted to open up to the audience. I think the mic is here. Oh, over there. Yes.
Good morning, habari zenu?
Kindly stand so that you'll be seen.
Good morning, my name is Njeri Njoroge from a resident of Nakuru. Na mimi pia ni mhadhiri wa chuo kikuu cha Egerton. So for me, what is coming out very clearly as an educator is that when I'm looking at the education in the finance bill, ni kwamba kumetolewa VAT, ushuru kuongeza bei. That means katika vitabu any other issues the university is using is already increased. So inamaanisha hiyo itaenda kwa mwanafunzi. Hiyo inamaanisha nini? Inamaanisha kuwa majority of the students who come from poor backgrounds will not be able to afford the fees. Tuende kwa afya. Nataka kuongea mambo mawili, education na afya. Hivyo ni vigezi viwili ambavyo ni muhimu katika ujenzi wa taifa, haswa hapa Nakuru. Utapata katika afya pia wameongeza VAT kwa equipment. Equipment kwa Kiswahili nini? Vitu ambazo vitatumiwa kutusaidia katika afya zetu. Hiyo inamaanisha katika kila, acha tuongee tu kwa mtaa. Ukiangalia mtaa, mimi natoka mtaa wa Shabab. Kwa hivyo utapata kuna chemist ukipita duka mbili chemist iko. Hiyo inamaanisha nini? Watu wengi wako tayari kutoa hela zao kununua dawa kuliko kwenda hospitali, kwa sababu gharama ya kwenda hospitali imekuwa juu na itaongezeka zaidi iwapo bill hii itapita. So hiyo inamaanisha, mimi pendekezo langu ni kuwa serikali ingeangalia hivyo vitu viwili, VAT kuongezewa katika masomo, education na afya. Hivyo viangaliwe, kwa sababu kama vile dadangu amesema, hiyo si bill ambayo inamtetea mwananchi wa kawaida. Yeah.
Masuala ya afya na of course elimu, so important, and we'll be talking about education, of course. Elimu tunaendelea nayo. Mambo ya afya, as far as taxation is concerned, the idea is you're paying taxes so that you receive services. Also, do you feel that you get quality health care as a result of these taxes that you're paying?
So the question is whether you feel that we're getting healthcare, we're getting the value for the money with everything that you're doing. Who has the mic? You can pass the mic around. Oh, you have a mic there. Let's try that. Tumia hiyo tusikie.
All right. This one works?
Yeah.
Yes. Did you want to say something? Okay. No. But yes, do you feel that you're getting quality healthcare? Let me give you this one. Yeah. You can have that mic passed to you. Yes, yes. Give him the microphone.
I never really wanted, but I guess it's common on
Oh, ni wewe ulikuwa unataka. Yeah. Sawa basi. Okay, it's the battle of the microphones. But I just want to know, do you feel like your taxes work for you? I see a hand up at the back there. As far as healthcare is concerned and getting access to quality healthcare.
Okay, good morning everyone.
Good morning.
I am Meshak from Baringo County, a student at Kabarak University. And on today's topic, as much as healthcare is concerned, addition of taxes, I don't think they are, if the government continues to add taxes on adding VAT on the local healthcare system, for example, on the medicine, I don't think the government is very considerate as much as healthcare is concerned, because healthcare is one of the very vital organs of the human living. If the government continues adding taxes, they are not considerate to local Mwananchi, because healthcare, education are one of the basic and main components of human living. Thank you.
Thank you. Seeing the mic go elsewhere. Okay, there we go.
Okay, good morning. My name is Amos Munene. I'm a student at Kabarak University. In as much as we are discussing about the healthcare, there are some issues that the government is not coming clean with us. Like, I was looking at the bill and I saw that healthcare and medical support shrinks. That means VAT exemptions on medical-related equipment services have been removed. What is the effect of that? You should ask yourself that question. When you look at the clinic, mission hospitals, kama hizo za mashinani, they will be charging more cost, more prices to access to medical equipment services. Because why? First of all, when you look at we end the aid program, the donations that we are getting from those international organizations. But now, let me talk of something like sanitary towels. They were being provided to the general public and the schools and the students for free. But when you look at the finance bill that is being proposed now, they are trying to reinforce some taxes towards those kind of things. Number two, on the matter of health, when you look at the medical cost for women, it is increasing. VAT exemptions on family planning kits, pregnancy and materials care items, specialized clinics. No clear budget for child care. We don't have some things like those. We should be talking about some issues like that. But the government is not coming clean. When you look at the SHA, whatever, shenanigans, when it was transferred from NHIF to SHA, there is nothing that is working. Thank you.
Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. And I'm happy to hear from, especially from Rono and of course from Alex, about the issue of sanitary pads. Are there any new proposed taxes on pads or the inputs that go into them in this year's bill? I haven't seen any, but I'm happy to hear. Yeah, let's pass the microphone to Alexander just before we get into the issue of healthcare again.
Thank you. This time around, we've not seen any provision that is increasing taxes on sanitary towels. Maybe what he was referring to is the movement of inputs for medicaments from zero-rated to VAT exempt.
Right. All right. Thank you. I wanted to get a feeling of lived experiences from you guys. Again, you pay these taxes so that you get these services. So healthcare, let's hang on that one. Who is, when you go into healthcare spaces, do you pay out of pocket? Do you have shift, SHA? Are you getting quality service? Wacha nianze hapa, alafu pale. Those are the first two hands. Yes.
Inasikika?
Tunakusikia.
Kuhusu mambo ya health, mimi naitwa Maurice Otieno, budget champion Nakuru Town East. Naweza sema kwa upande ya healthcare, yale ambayo wenzangu wamesema, kuna kitu ambayo lazima pia tuongelelee zaidi, kwa sababu wanasema kuna shi na sha. Hii shi na sha, wakati ambapo umeenda hospitalini, ukitibiwa haupewi dawa. Dawa yenye unaweza pewa ni dawa yenye tuseme kama Panadol. Alafu dawa yote ambayo inaanza shilingi 200 ikiendelea, unaambiwa uende ununue kwa chemist. Inamaanisha mimi mwananchi wa kawaida, kama nitakuwa nimegonjeka na nimeenda hospitalini na sina pesa na nimelipa SHA, iwezi nilipia madawa ambazo nitakuwa natumia. Nimekuwa na hiyo experience kwa sababu nimekuwa na kama wagonjwa wawili ambaye wanatibiwa, wanaandikiwa dawa zaidi ya 3,000. Saa hizo hana hata ndururu. Kwa hivyo kwa upande ya afya tunaona kuna upungufu ya hiyo SHA na SHI na jambo lingine, level 5 hospital kiwango kikubwa wamewachia county, na pesa haiteremuki kutoka Nairobi kukuja kwa hizo level 5, level 6 ili iweze kusaidia mwananchi wa kawaida. Kwa hivyo kwa upande ya afya hatujaona kama hii bajeti inatuelekeza vizuri. Na kwa upande ya education wametoa ile food, ile chakula ambaye watoto walikuwa wanaenda shuleni wanaweza kula. Na unakuta kuna sehemu zingine ambayo ni kame, ambayo chakula shuleni inavutia watoto kwenda kusoma mahali pale. Je, sasa kama wametoa hiyo, wao watoto watasoma lini? Asante.
Ni kweli kuna watoto wengi sana wanafika shule kwa sababu ya chakula peke yake. That's the thing keeping them in school. But let's hear from this gentleman here. Yes. Tuambie jina lako kabla uanze.
Naitwa Shinali Francis kutoka hapa Nakuru. Mimi ambao nimeishi nimeona kama na experience kwa haya masuala ambayo tunazungumzia, na nikitumia yale ambayo ninajua kutoka zile miaka za zama, ninaona kama kwamba hii budget ama the budget system the previous few years imekuwa kama ni punishment kwa mwananchi ambaye ndio anatoa pesa, ambaye ndio analisha wale wakubwa. Kwa sababu if I remember very well, in the 80s the budget day used to be celebrated. I used to see my dad, siku hizo hata haendi kazi, watu were glued to their radio kusikiza budget. Na increments wa ndururu, penny, okay, wakati huo. Lakini kwa sasa, ukisikia ni budget, we make noise. We have now reversed what we used to do, tumeenda upandole mwingine. Why should we make noise? Ni kwa sababu tumefinywa sana, such that wale ambao wametufinya ni wachache, wametuweka chini kama mattress na wametukalia kabisa. Now, on the health system.
Kabla uende health kidogo, hizo 80s mlikuwa mnashangilia nini haswa?
In fact, ilikuwa kama holiday because unakuja kusikiza mipango ya serikali. I remember those days wakati Firestone ilifungua kiwanda Nairobi. ilitangazwa wakati wa budget day, rais ndio alitangaza, and everybody was relating sababu kiwanda kitaleta kazi, vijana watapata kazi. Lakini wakati huu ukisikia ni kiwanda hata ushughuliki. So upande wa afya, mimi kazi zangu mara mingi niko kwenye community. We do a lot of community mobilization. Mambo ya budget tunawafunza community groups, women groups, youth groups. But unfortunately the system inatufail kwa sababu wakati unayemfundisha mwananchi mambo ya budget, alafu serikali inatangaza ile budget kama leo itasomwa hiyo statement, mwananchi anafikiria nini? Sitalaumu serikali, nitalaumu mwananchi mwenyewe. Because when you look at the constitution, the legislature should oversight the executive. Now it has gone the opposite. The legislature hata you oversight on the executive, because when we have the BPS ikienda bunge, what do? Wanatazama mahali pao kwanza, tumeongezewa allowance, ongezeni CDF, ongezeni sasa women reps, anapewa nini? At whose expense? At mwananchi expense. So yule mbunge tumechagua haendi kututetea, ni interest yake. Anatusaidia kuchimba lile shimo zaidi, tuingie ndani zaidi, and I can say in the next 5-10 years Kenya will be different. It will just be negative, negative, negative. Up to our minds will be negative. We won't see anything
unless we fix it.
Yes, I was just about to say,
and that's why we're here, to fix it.
Yeah.
Yes.
Right? We'll hear about what your thoughts are on health, but let's first take a break. We are having a conversation on budget, the Mwananchi budget, bringing the mic to the ground today. We are in Nakuru County in as collaboration and partnership with Okoa Uchumi here at Nakuru, where we are asking ourselves and asking the citizens, what do you feel about this budget? Is it addressing the issues that you feel it ought to address? We'll be back in a moment to continue this conversation. Fixing the nation, one conversation at a time, even when the mic is on the ground. To Mike Ground today. It's in Nakuru. We are having a conversation around the budget, and as we've been seeing, there are people who are just, all our eyes across the country are glued towards the National Assembly today, Parliament, where a joint session of Parliament will be held today. The Cabinet Secretary for the National Treasury will be addressing Parliament and releasing his budget statement. But what's in that budget? So we are having a conversation with some residents of Nakuru County in Nakuru City, where we're asking what is the Mwananchi feeling about the budget. And just before we went to the break, kuna mzee alikuwa anatuambia mambo ya zamani na sasa mambo ya sasa. Sasa turudi mambo ya sasa mzee na mambo ya health. Unaonaje about funding for health? You're a budget champion in Nakuru. Unaonaje mambo ya funding for health? Is it sufficient? Do people understand that, for example, if you go to a primary health facility, a level 2 dispensary ama health center, unafaa kuingia, useme shida yako, uangaliwe na muuguzi, utoke hapo uende nyumbani without paying a shilling. Does that happen to anyone? Is it an experience for anybody? And do you know whether that happens?
Yes, nikiendelea, I wish serikali inge promote na kuweka nguzo zaidi kwa level 1 and level 2 hospitals facilities, because that's where the mwananchi is. Ukienda level 1, people on level 1 are not paid appropriately, na unakuta pesa ziko kwenye budget lakini zinakuja baada ya miezi 3 miezi 4 na ni pesa kidogo. So demoralization.
Nani hawa? CHPs?
CHPs.
The community health promoters are not getting paid regularly?
No, they are not getting paid regularly.
Allah.
Now, level 2 facilities, with now dispensaries, they are supposed to be totally free. But unfortunately, they are free in terms of kuandikiwa kadi, na kuambiwa enda pale. Ukifika kwa pharmacy, dawa ni ile the basics only, the paracetamols and occasionally the zile amoxicills occasionally. Otherwise hakuna dawa hapo chini. Mwananchi mara mingi ni harambee zifanywe ama mkimbie kwa MCA ambaye tena ni ugonjwa mwingine tunafungua hapo. So level 1, level 2 zingekuwa tu na nguvu za kutosha. Level 5 and 6 wangekuwa na kazi mingi, pesa mingi ingerudi hapa chini.
Okay. Just for context, as we continue and pass the mic around, in the next financial year's budget, there's an increase of 6 billion shillings to the primary healthcare fund. That is those level 1, 2, 3. An extra 6B is going into that. And an extra 5 billion shillings is going to the emergency, chronic and critical illness fund, where you are also not supposed to pay a shilling. The only level where your money plays a role is in the level 4s and 5s and 6s. Also not out of pocket 100% because you're a member of SHA and you've been contributing to SHA. So SHIF pays higher. Mariam, tuendele.
No, kuna contribution hapa because you're absolutely right. If you're contributing to SHA, should not be out of pocket. But I think in many people's experience, bado kuna kakitu. The medicine, great point. I don't know if it's the same for other people. When you visit a dispensary or, level 1, 2, you end up paying for the medicine, right? Okay.
Good morning, everyone. I'm Obala Chris. I'm a medical student at Egerton University, currently based at PGH. I want to give a real experience, what I've seen, what most of the patients go through. In most cases, especially for the patients with chronic illnesses, they normally come for the MOPC clinics. But you find that the drugs that they're supposed to be...
What's an MOVC clinic?
These are clinics that are supposed to be checking on their healthcare.
Okay, regularly.
People with chronic illnesses, people like diabetes, hypertension, and the rest. So you find that these people normally, when they come, they have to be given medication. But when they visit the pharmacies, actually most of them do complain that these drugs are never available in the pharmacies. Then this brings the question that, then why are you paying for the SHA? Because actually you expect that this SHA is supposed to cover for your health care. Now this has a negative ripple effect on the health-seeking behavior of most people, because now you will find many people shying away from visiting healthcare facilities to get healthcare access. I think this is very wrong, and the government need to do something about it.
Agreed. Wait, by a show of hands, ukisikia kichwa inauma, fever, unajua kusikia malaria. What's the first thing you do? Go to a dispensary? Chemist, show of hands? Yo. Go to the dispensary? Yeah,
Why?
Why is a good question. Kuna jibu hapo. Let's get that mic to her. Her hand was up. Just give it to her, and then we'll pass it back. We'll pass it back to you.
Good morning, everyone. My name is Faith. I'm a student at Kabarak University. I think the problem is why we prefer going to the chemistry rather than the dispensary is because of the reluctance of the doctors and the nurses. The problem is they are being taxed. They are doing their work day and night. Of course, they get tired doing all that. So the problem comes in when the government try to fund other sectors rather than focusing on the health and the important things to the Mwananchi. I think now the problem we know is because of the reluctance of the doctors. Thank you.
All right. So you don't feel like you get the quality of healthcare that you deserve. Sorry, this gentleman he really wanted the mic. Poleni. Inapita, msijali, inakuja.
Good morning. Good morning, everyone.
Good morning.
My name is Eric Otieno, a student from Arvist. I have a concern, and it's out of my research, that on health, we get that when you go to the hospital, you are told to buy medicine the way let me call him my father has said. But the reason might be You know, when you are not paid well, you have to get another strategy on how to care for yourself outside the government. Let's say you are being employed, then you don't get the regular payment. You'll have to use the equipments that are around you to get what you want. So here comes a case where the doctor might use the medicine, auzie mtu kwa pharmacy. That's why anakuprescribe urudi kwa pharmacy yake, uende ununue dawa, ndio usaidiwe. Pesa ikuwa like dawa ikuwa 200 and above. So you'll find that anatumia hiyo njia kujikimu because he's not getting the right services from the government. Unaona?
Lakini wacha nikuulize.
Yeah.
Unajua saa ingine pia si vizuri kuchomea madaktari hivyo. These are people who have gone to school. Are we saying that a majority of the reasons why you'd go to a facility and not find the full service is because the medical officers and clinicians are playing the underhand deal?
That was just an example.
It's an example.
And then it is a research example.
And it has been found to be true?
No, it is from myself. You know, we talk about it. What I want to add on it, I just want to add something on that, because where I come from, it's like local. It's a local place, and that's the complaint that has been raised. So I'm here just to air it out. If it has been happening, we find a solution
to it
and an evidence for that, because people have been complaining of that. So I just came to represent that to you and to other people who might have a solution and to get how to help us. You get the point?
Okay.
So it is not that I have an evidence, but it is a complaint from my people or from the people around us. Yeah, so I just raise it so that we get a solution. If it's happening, we find a way out. Yeah.
There's a lady here who wanted to say something. I can see there's so many hands up. We'll try and get through all of you before we move to education. I know healthcare is a particularly sore spot.
Good morning, everyone.
Good morning.
My name is G. Jenga. I'm a human rights defender in Nakuru and also a youth champion. On the concern that you raised, the reason I feel like most people would rather go to the chemist instead of going to the dispensary or the level 1, 2 is because it's convenient, yeah? The fact that you have to go queue to get services, and like my predecessors have said, it's not value for your money. And when you go to those healthcare facilities, I can't go there, spend 1-2 hours queuing, and I'll just go maybe get the same painkillers I would have rather gotten in the chemist. Also, I feel like in terms of healthcare system, I don't think there's value for money. Because if there was value for money and now the tax increment to the common Mwananchi ingekuwa make sense, we wouldn't be having like people us in Nakuru demonstrating that there's a lot of incompetence, like in our level 5. People are dying. We don't know what is happening. There's just a lot happening. So in terms of healthcare system, I feel like we're not getting value for money. And also the introduction of the SHA. The system was done in a very weird manner, for lack of better words. The transition wasn't properly done. And that's why we find now the CHPs in the hospitals telling patients when they go seek services, you can't get services until we register you for SHA. So the fact that that inhibits you from getting, you're feeling sick, I don't need to come to the hospital feeling sick, and now you need to make me queue, register for SHA in order for me to get services, you see. So I feel like it's not working. We need better ways to solve these issues, and the government will have done better in terms of transitioning the SHA and also, like, you know, bringing back to the common ground and actually asking if we, the citizens, want that. Because paying for 2 years and you can't even access the services, I don't see the need for doing that. Yeah, thank you.
Okay. There's so many hands that are up, and I know we're just about to go on a break, but I want to see, show of hands, anyone who SHA has worked for. You are able to go in, get your medication, actually see a doctor or a community health promoter or a clinical officer, someone along that chain, get your medication, go home. Aye.
Let me share my lived experience, but now personal, yeah. Like it's been like a month or 2 ago. The whole family was sick. We had a cold and a headache. And The good thing is that I had to come to Viwanda. If the hospital is in Nakuru East and West, you're likely to get the services. I come from Rongai. And I came, we spent almost 700 shillings to come and get treatment. I was actually coming mainly because of the consultation. Nipate daktari ambaye amehitimu, anipatie consultation. Na mwisho, of course, they gave us half the medicine, but dawa yote ilikuwa 250. Okay, we ended up spending 560 on medication for the extra medicine that we could not get. Now, if that was in, we have another facility, Apple Bridge, I don't think I would have managed to get that kind of service in terms of dawa. Apple, dawa, they are less. Okay, that is the first one. So the SHA, when it comes to consultation, for me it worked. Less medicine, I paid less for medicine, but I paid a lot for transport. And that reminds me of a public participation that happened last week. This week in Ngata. We as citizens, we are asking for a good hospital at Ngata, where the police station is, where the government wants to put up affordable housing. In Ngata, we do not want that affordable housing there. We are asking for a hospital, a higher, like level 3 or 4, where I don't have to travel to Ngata. And what happened to the public participation? The area MP came with goons. I have video clips to show that alisema tu wenye wana support hapa, wenye hawa support wakuje pande hii. Citizens are clearly saying, we want a health facility. Actually, Ngata is between Salga and Bridge. Accidents are happening there every day. If we had a better facility there, trust you me, we would have saved a lot of lives. Let's look at, they are competing, wanasiasa wako na agenda zao.
Let me
what I'm
interrupt you,
saying,
Joy. Sorry.
SHA is working in some areas,
Yes.
but not all.
I just wanted to know this public participation.
Yeah.
The crux of it was against this side, for this side. That was it.
The aspiring MP and the current MP came, both with goons. Young people, they are even coming to our places, wanatuambia, twendeni tunapewa 500. Really? The politicians also are really having a serious impact on our services. They are sabotaging the process. When you come with people at a public participation to heckle at the genuine Mwananchi who really want development, it becomes unfair. And some of us have etiquette. We don't want to shout. We just know how to speak quietly and respectfully. But now if you come with young men who are hungry, hiyo ni pesa yake hiyo siku. They don't care about tomorrow. Akipata pesa ya leo, they are good. But
wamekuja kibarua ya siku.
Yeah, wamekuja kandarasi. Let's really stop this as leaders. Let's be accountable.
Back to your question on this comparing the health services. Yeah. So you say in some constituencies, some sub-counties in the same county, you will walk into a health facility and get full treatment. You'll find a clinical officer and you will get consultation. You will get lab services if you need them. You will even get medicine at the pharmacy. And in some you will not.
Yes.
And both are public.
Yes.
In the same county.
Yeah. Actually for us, kama mimi niko na akili, nitakuja kwa hospitali instead of self-medicate so that I am safer. Because if I go to a private clinic, they will charge me consultation. Okay. And something else this young man was sharing, I didn't get his name, about a doctors being crooked. Yeah? There are always those naughty people. I'll share this. I know it's in relation, not so much in health, but it is related with education. There's this lady who was looking for a birth certificate. And because she's ignorant, daktari si huwa anapatiana birth notification. Anamwambia atoe 10K. Mama wa kibarua anaendanga shamba kila siku ndio afanye kibarua. Lucky for her, when she came, she had a birth notification. Nikamwambia, hii ni sosa hii, you'll spend less than 500 or 600. And I helped her. She had gone to a clinic, it was private, and akaitishwa 10K. And it is someone I know, I can show you. Unaelewa? And she came, she's been coming there to celebrate, to our office, to celebrate. Hey, thank you so much, thank you so much. Just because she can't use, just because she can't use e-citizen. Medic somewhere wants to take advantage of her. It's quite unfair. Let's be professional.
We're going to the top of the hour and to take a break, and then we come back and continue briefly on the matter of health, and then also mix it with the matter of education, and to see what people feel about the budget and education. And I know Rono will also want to give us, that perspective. National government functions, county functions, funding at national level, funding at county level. We are fixing the nation one conversation at a time. Today's conversation is around budget. Today, at Parliament, the Cabinet Secretary for the National Treasury will be speaking there, and Ibrahim Karanja from NTV is actually on the ground, and he is, already seeking to understand what people expect from these matters, and what people expect the Cabinet Secretary to say, what people already feel about this budget that's coming up. I don't know, we cross over to Ibrahim Karanja briefly, and then he'll also taking us to a break. And then after the break, we continue this conversation. One conversation at a time, 9 a.m. Ibrahim Karanja.
Well, I agree. I'll start with, there's a lady at the back here. I hope the mic is close to you. Let's get the mic to her and get a few final thoughts on healthcare before we go into education. Right.
So good morning, everyone. My name is Esther Mwende, or I like Hadassa. I'm a medical student, an artist, and a human rights defender. I interned somewhere early this year, I wouldn't say, but it was a level 3 hospital. And let me tell you, from inside information, women will come to the maternity ward. They are in pain. The middle, Konasha, kama una lazima register, I'm 10,000. And this woman is in pain. And you're wondering, how is the system not working? And I was there in the reception, in the ward, and I will see the systems literally hanging, like delay for 2 hours. Someone is sitting on the chair, being waited to discharge, and because of what system imehang, there's nothing we can do about it. I, from personal experience, I can't go to a public hospital anymore. Why? I've gone so far twice, and every time I went, ilikuwa, you don't have money, so you can't get any services. Dawa 5, 1 is only provided painkillers. The others go for the chemist. There's a chemist next there. So unajua kuna ka chemist hapo. So unatumwa kwa hiyo chemist. And upate ile test pale. So I had 2 tests that day. I went for the 2 tests, paid 1,000 shillings outside, came back in, didn't get the medicine. Yes, prescribed for the medicine, had to pay 2,000 again outside to get that medicine that is supposed to be facilitated by the facility itself. I pay for SHA personally, 300 per month, but see, it's not working for us. And I've seen people will come with cash, wanaingishwa kwa line, wanapitishwa, and they're smiling, and we are seeing what kind of systems are we having as Kenyans, not even the medical people themselves, us as the people. What are we doing about these systems? Because it's already rotten. Are we just sitting down about it, or are we very vocal about it? Because even from the inside, the system is already not working.
Let me go to where you started. You're telling me women would come to this facility at level 3 in labor,
yeah,
and they're told, register. Ukona SHA?
Yeah, because it's either that or you have cash to pay so that you can be delivered your child.
Mm-hmm. That is incredibly scary. I know there's so many hands going up. There's a gentleman over there that had wanted to speak. And then we'll go to the back as well, because we haven't heard from the back of the room. Yes, green shirt, I see you. Haya.
Yes, asante. Kwa majina naitwa Mwangi Muraya wa Nyambugi, nimetoka shirika la CGG na pia Nakuru Human Rights Defenders Network. Na tunapozungumzia swala la afya, nadhani tunapaswa kuyapanua mawazo yetu. Serikali pia inapaswa kuwa ikiallocate human rights, kwa sababu pahali ambapo hakuna human rights, hayo mambo ya maradhi yatakuwepo. Kwa mfano kama vile ripoti ambayo imekuja hapa, mauaji mengi yamekuwa yakifanyika hapa kwetu Nakuru. Saizi kuna mtu angekuwa hapa, lakini saizi wanashughulikia pale postmortem kwa mochari kwa wale watu ambao waliuawa pale Marakwet. Hapa kotini tuna Richard Otieno, kesi yake inaendelea hapa. Mama Brian ambaye mtoto wake alipotelea game park ako pale. Mambo haya serikali lazima ifikirie jinsi ya kuallocate human rights. Na human rights ni kama haya madawa ambayo tunapata hospitali. Saa hizi na tusidanganyane, Kenya kila mtu kichwa chake hakiko sawa kwa sababu ya mauaji ambayo yalipo hapo. Budget yetu inasema nini kuhusu hilo? We need allocation of funds kwa mambo ya witness protection agencies. Hawa hakuna pesa za kutosha, ukiwasikia hawana. Tunahitaji pesa pia ziweze kuwekwa kwa Kenya National Human Rights Commission ili kufuatilia mambo ya hizi mambo na human rights violation, na pia vile vile ipewe pesa za kutosha. Na zaidi ya haya mahospitali ambayo tunazungumzia hapa, we need trauma counseling centers. Na hilo ni jambo ambalo linajulikana hapa Nakuru na kila mtu analijua, si ati naongea kwa mtu binafsi. Kila wakati tunapoenda mahakamani, Mama Brian kesi inapoanza pale lazima anguke chini pale kwa sababu ya mtoto wake. We need trauma counseling centers, na hilo swala lizungumziwe kwa makubwa. Pia vile vile tunahitaji human rights ifundishwe polisi wetu, kwa sababu mauaji mengi ambayo mnaona hapa yanatokana na hawa askari wetu. Hata juzi Sunday tuliweza kupoteza polisi mwingine pale mtaa wa Freehold alipopigwa risasi na magenge. Kwa hivyo serikali tunaiomba na sijui tuna demand kwamba it should allocate human rights allocation in every budget, in every aspect of the budget, kwa sababu without human rights hakuna pahali ambapo taifa hili letu linaenda.
Ni ukweli. There's a gentleman in green at the back amekuwa akiinua mkono for a very long time as we wrap up on the health bit and get into education sasa.
Yes, good morning, Kenya.
Good morning.
Good morning.
By name, I'm Magadi Dennis Olwach, a student at Kabarak University and also a youth activist. And when you're paying taxes, our slogan is tulipe ushuru tujitegemee. Na je, baada ya kulipa ushuru tunajitegemea kweli? On matters health, I've experienced both private medication, public medication, and also traditional medication. If you go to the public hospitals, when you are coming from home, your parent will tell you, toka asubuhi, kwa sababu kuna line there, almost of 150 people. Even a day, there is a time that they'll tell people that, go back home and come back tomorrow. At midday, when our doctors go for lunch, they take even 50 minutes or 1 hour, and there are patients who are waiting for them. When they come back, they will ask patients at the bench, how many of you have SHA or the insurance or have cash? Come. Those of you who don't have, please still sit. Then when you go to the private hospitals, if you can pay, like private hospitals mostly, if you have money, and for the common Mwananchi like us, most of us cannot afford going to private hospitals. In private hospitals, there are all resources that are required to treat Kenyans. And if you go to the public hospitals, you find that there is laxity of doctors because most of them, some of them we don't know even if they are qualified to have, or some of them are just sitting there because they tell you that, okay, let me call the doctor, and you found them sitting inside there. So you are asking yourself, what is the work and how is the government making sure and ensuring that the facilities, hospitals that are public facilities, are working and efficient? And my brothers and sisters, I want to tell you that I have experienced public medication, private medication, traditional medication, and I recommend traditional medication. Thank you so much. And yes.
Guys.
Okay. Allow me to weigh in.
Basi.
Now that I have the microphone. Okay, good morning.
Good morning.
I'm Alejandro Achach, a medical student at Egerton University. Now, it is said that agriculture is the backbone of the economy, but at this moment, just allow me to say that healthcare is the backbone of our economy because it's a key determinant to the performance of our economy. And at the moment, we have an ailing healthcare. Why? Because the government is pushing in a social health agenda, and in the social health agenda, I'd say, let's say it has two cadres, where we have the professional and the CHPs. And the CHPs, in the budget, they're having an additional 6 billion. Real issues have been addressed by the Mwananchi inside here, whereby there's congestion in the hospitals. And ideally, the congestions in this hospital is because the government lacks a goodwill in employing doctors. Why? You'd come to see in some counties, a whole county is employing 2 medical officers. There was a case in Murang'a County where a whole county is employing 2 medical officers. And the 2 medical officers are expected to serve the people. Therefore, our
Murang'a
problem...
County has 2 medical officers?
Yeah, actually there was a case back then in Murang'a, that the whole county has only 2 medical doctors employed by the county government. And therefore, we need to have a goodwill from the government to ensure that we have medical professionals within our hospitals. So that's the only way we're going to cure the problem of congestion in our hospitals. And again, the problem of drugs, we need to remunerate our doctors and as well our interns. Let us have a seamless transition from university to the interns, to the internship, so that we can ensure that our interns are trained in time and we have medical officers to serve us at the appropriate time. Thank you.
Asante. As we continue, by the way, as how we fix the nation is also by making sure that we are well informed. Okay? How you determine and you distinguish between misinformation, disinformation, fake news, and so on and so forth, by seeing whether you can verify information. I think just by hearing it, the probability that Murang'a County would have only 2 doctors employed is highly unlikely.
Yeah.
Right?
I'm looking at a few sources that say it's quite different.
It's highly unlikely.
It's highly unlikely. About 34 employed in public facilities, which has a ratio of 1 to 30,000 residents. Not ideal, but those are the ones. That's what's publicly available. Yeah, but I think, it's good that we keep it within what's actually verifiable information. And then our lived experiences, of course, because those are our lived experiences.
Yeah.
I think we should transition into education now. Because, again, bedrock of our society, health, education, because of time. I know we still have so much to say on health, and it's incredibly sensitive, but let's move on to education, higher education, but also basic education. Tuanze funding model ama tuanze basic education? Basic education. Hi. Funding.
Tuanzie chini tukienda juu.
Yeah, tuanze chini tukienda juu. Aya. Basic education. We now have competency-based education, CBC. We've moved to transition to that. I know there's a lot of people who sit in higher education here, and we'll get to them. But from a basic education perspective, have you noticed an improvement in the quality of your education over the last few years? If you have children in basic education, if you have nieces, nephews, if you are a teacher, what changes have you noticed in the quality of education, in capitation, how often it comes, matters like those? Let me see if there's anyone that, okay. Tuanze hapa, his hand was the first to go. Oh, amekwamia. Aya. I respect it. It's a boss.
Na huyu mzee anafanya kazi mzuri sana kuwa kiranja wa microphone.
Yes. Tuliagana na yeye, and he has kept his word.
Ndio kiranja.
He has kept his word.
Good morning.
Good morning.
My name is Grace Kimone, the Deputy President, Central Kenya Youth Association, and a law student in Kabarak. In regards to education, the CBC model first, to some extent it's working. To some extent I feel a lot of burden is placed on the parents. We have younger kids at home. When assignments are given, you're told, go make a guitar, go or tell your parent you need this. So it is not as cost effective, because if you're in Nairobi and you're told your child needs clay the following day, you need to buy clay for the child to take to this teacher. Also, in terms of the feeding program, in some counties it is working, in some it is not. So some kids do not have food at home, and they are depending on the feeding program at school. For example, the porridge or the lunch. If we scrap it off and allocate the money to other unnecessary things, then I think our education system is messed up a lot. So when we are giving our comments, we are not really giving an alternative, we are just giving our problems. So I think when we are giving our problems as Gen Zs or the Kenyan Mwananchi, should give the government an alternative. As much as sometimes they don't do anything about it, probably they don't have people to give them alternatives, because most of these advisors are not actually doing their jobs.
That's very true. There was actually something I was looking at in the Daily Nation called CBE Connect, which is prep for learners who are about to sit either grade 6 or grade 9 exams, right? So it's a pullout that has, it's going to be happening every Thursday, actually, every Thursday in the Daily Nation, a pullout that has prep for grade 6, grade 9 examinations. You get to see all of that. It's really useful for students.
Yeah.
And we get into places where you can be able to do a little bit of revision, you can do this. I wonder though, the prep has to be the entire process. You're prepping for your life, not just an exam, right? So then from an education perspective, the shift has been very sudden, and it does require a lot of parents. It does require a lot of the learners. Are we equipped enough to be able to do this competency-based education vizuri? That would be my next question. Yes,
and from a budget perspective, as the mic comes, the education is always the biggest budget item in our budget, right? I confirm that, Rono? True? Nod, Alex? Yes. Okay. So that being the case, we also are seeing that because of, what they are calling constraints in the budget, there are some areas where there's a reduction in the budget allocation in the next financial year. 5.9 billion shillings going out of capitation for primary, junior, and secondary schools. 5.9 going.
This is what Joy was talking about. We already went down from 22,000 shillings per child to 17,000.
Yeah, and now there's a
further.
further one.
Okay.
There's a further one because it's been at 17,000 used to be 22,000 before. It came to 17, and that 17 there's still some 5,000 that's retained at source in a Bakiko. Now there's a further reduction in this so we can fund exams for this year. There's also more reduction for school feeding, and you talked about school feeding and the importance of school feeding in what it does in school retention and attendance, right? So there's a further about 600 million shillings, 620 million shillings that's just going from the capacity building for teachers, an extra amount of money that's also going to be reduced from school feeding program. So there's some element of defunding in the education sector at basic education level. Now, the mic can go. Hi.
Good morning once again. My name is popularly known as Muna in Nakuru County.
Your name is popularly known as Muna.
Muna in Nakuru County. However, my mother and father call me Maimuna Mwinyi. I work with a CBO well known as Youth Bilanoma, and I'm also a human rights defender in Nakuru County. I'll say that CBC was a good structure. However, the implementation part of it, they're really frustrated in implementing without further consulting on how to escalate and implement CBC. They never focus on matters of how to fund CBC, how to equip the teachers, matters of infrastructures at the school. I'm speaking this because I was part of the board in a school here in Nakuru. And those are some of the conversations we kept talking about.
Right.
And until this year, that is when we finalized in constructing a grade 9 classroom, which was ought to have been focused on years back. You see? And these
when the students are about to engage,
because those are some of the things that they need to have foreseen before even starting to implement CBC. And I will say this, it was more of the politicians, what they really needed more, and not focusing on what the children really need. I think it's a high time that even the politicians need to sit down with the children to have public participation with them, for them to tell them what they feel and what they really want. For public school, CBC is 50-50 working, because you'll see most of public school have children who come from a humble background. And more time you'll find a parent going to maybe Kware, akikuja amechoka ama akuje kama amechelewa. Then you tell this parent, aende atafute hiyo crew unasikia. Ama acha ta crew, mwambie atafute nyota. Ataanza kutafuta nyota wapi na mtoto? Ameingia kwa nyumba saa moja. Anafaa kupika, afanyishe mtoto homework. And then you see, they need to find ways right now, because when we are moving forward, it is the best system actually, because it helps a child realize his or her dream. But honestly speaking, the implementation, it was more political. And let me even go back to health. Even health, if they stop politicizing health, we'll really go far with health issues. Because I know most of us who are seated here, we just know about the SHIF. But what about the primary health care fund? What about the emergency fund, part of it? What unalipa pesa kidogo. Joy have not spoken about her experience when she was told to pay 3,000 shillings. But she was not told she's paying for what. So to register SHIF because near social, near wakulima wa chini, wale wakulima wa juu wanakuwa well oriented about these other 3 categories za chief. You see, the government need to tell people in black and white where we are heading and what they want.
Right.
Sawa.
I agree. I want to stick to the education bit just a little bit, and basic education kidogo tu. Wangapi hapa ni wazazi? All right. Kuimplement CBC ni kazi, si ndio? Ni kazi. Is it work that you're doing collaboratively with the government, or you feel like you're doing it alone? Collaboratively.
Kuna watu wamesema alone. Kuna homeschooling hapa.
Ni wapi wewe alone? Aya. Because I want us to wrap it. Oh, we have CBC teachers in the room. Aya, basi twende pale. Let me
budget.
Wacha tuanze na walimu, wazazi, then we go to higher education. Sawa? Aya, tupe ule mwalimu mic tafadhali.
Okay. Good morning again. As a teacher in the teaching profession, we can all agree that CBC is working. CBE, it was recently updated to CBE. It is really working. When you compare the students of a CBC classroom with those from 844 system, I included, we all can agree that this system is really working. For example, on Thursday last week, I'm a teacher of home science. When you look at, when you taste the food that CBC teachers are cooking, yes, we can all agree. Yes. It is really, those kids are really talented. CBC aims at absorbing the talents of these young learners. And again, it really equips learners with self-confidence.
Mwalimu, wacha nikuulize, because we are talking about budget.
Yes.
Is CBE well funded?
CBE is not well funded. We must agree on that one. If it is fully funded, then the funds are not getting into the mashinani schools. Yes.
Asante. I wanted to speak to the funding as well, in 1 minute or less, because we have to go to higher education, and of course it's budget day as well. So very quickly.
Thank you. My name is Kevin Karuga, and until Feb, I was implementing a USAID-funded program in education. What I can say about basic education, especially CBE, it is that right now the government is in shock because of the dismantling of USAID, because USAID was funding a program called Kenya Primary Literacy Program and USAID Reading Champions. Those two programs were supposed to improve literacy and basic access to CBE from grade 1, 2, and 3. So what happens is it's a 43 billion program, 43 billion for 3 years. That is quite a lot of money. And if someone takes away 43 billion, it's going to leave a very huge gap in education. One thing I know is that KICD had already published books. Right now, we are still in the closeout of USAID. We are still distributing the books in schools. And I know Ngata has benefited a lot, Ngata and Solai. And what happens is the government has to fill that gap. So what I can say is when planning, the Ministry of Education was reluctant, knowing that funds are going to come from the donors. And now that DOJ has dismantled USAID, they have to fill that gap. And it's really going to affect the CBE, especially now that approximately 15 billion was going to train teachers. In Nakuru, it's only Ngata zone. You know, education is still divided in zones. It's only Ngata zone which has already benefited because the teachers from that zone were trained. And the kind of training that they're doing, you can clearly tell that budget has really affected service delivery in terms of capacity building. What they can do, the teachers from other schools, I think they're missing those skills because there was inconsistency whenever they were trying to transition from 844 to CBE or CBC. It's called now CBE, competency-based education. And one thing that is a missing link is the aspect of values. You know, CBC has to have an impact on knowledge, skills, attitudes, and values. So when you talk about values, even how can the government fund parents to collaborate with teachers to instill the values, the national values that we have in our constitution? Is it chapter 4 or chapter 6?
Article 10.
Yes, so that is always the missing link that the government is struggling with, how to incorporate teachers.
Asante. We continue this conversation, but also remember today is the day when John Mbadi will be going to Parliament and he will be speaking, and all of us, of course, will be listening to what John Mbadi says. It's his inaugural budget speech in Parliament. He comes back after having been a leader of the minority, a member nominated, and now in Waziri. Ibrahim Karanja and Nina Shaban are at Parliament, and they are speaking to some of the people who will be speaking there. Let's hear from them a bit, and then we come back and continue this conversation. Fixing the Nation is in Nakuru County today. Ibrahim and Nina.
Well, a very good morning to you, Mariam and Eric Latif. I understand you are in Nakuru. Well, it's quite a cold morning right here in Nairobi, but it is the biggest day on the business news calendar. It is, of course, the budget day, budget statement reading day.
Yes, John Mbadi's maiden budget statement, and this is after he was brought on board into the broad-based government last year. At a time like this last year, we had Professor Njuguna Ndung'u as the CS Treasury, but later on, following the unrests that came with the Gen Z protests, we saw the president reorganize his government and brought on board several of experts from Raila Odinga's side, including John Mbadi, who today is expected to read the very first budget, whom many say perhaps he will turn the tides for the president's administration?
Probably. Now, Ibrahim, I do know that you understand that I'll be leaving Ibrahim right here at Parliament. I'll be taking my stroll down to the Treasury offices to see if we can just try and have a chat with him, a conversation with him. How does he feel for this first time of him presenting the budget statement? And just to look through a few numbers, Ibrahim, Kenya's 2025 budget is the biggest budget that we have ever witnessed at 4.23 trillion shillings. Now, so what exactly does the 4.23 trillion shillings have? Allow me to just give you a minute of your time. So in this amount, 3.1 trillion shillings of the total budget covers recurrent expenditure. On top of that, over 1 trillion is expected to foot interest payments on both domestic and foreign debt alone. So that's 1 trillion shillings that is going to pay for interest alone.
Interest, not the debts.
Not the debts yet, but interest alone. So this is a conversation that we definitely want to delve into and expound more and more for our viewers. And I mean, we have quite a number of hours until 3 p.m. when John Mbadi, the Cabinet Secretary, will be crossing over to Parliament.
And then there are questions, even as we speak about 4.2 trillion shilling budget, there are questions about how much are we able to raise ourselves as a country, and how much will we be looking to borrow as a deficit that we have? Are we speaking about a budget that we are having an increasing deficit every so often? For instance, we saw in the last financial year what we had as the deficit when the budget was being read ended up increasing.
Of course.
So is it something... If you can take us through the numbers and tell us how much are we looking to raise within, by ourselves here, using our own revenue?
Fair enough. So where will Kenya find the funding? Allow me to read, because you know you cannot mess around when it comes to Marty's numbers. So the net domestic borrowing will be fully funded from the issuance of domestic treasury bills and bonds and other forms of domestic financing, such as the CBK overdraft in case of shortfalls. Now, on top of that, the net foreign financing will meanwhile be a mix between commercial and concessional sources, but a part of the concessional or cheap financing will be mopped up by the World Bank's development policy operations. Of course, we'll give you more details in the course of the day.
Yes, of course, we will be coming to Parliament. Nina is crossing over to the Treasury right now, and we will be having the all-important conversation. We will sit with members of Parliament. She will sit with the Cabinet Secretary on the other end, because this is a conversation about you, and it's a conversation that here at NTV, we're going to make sure we bring you 360-degree.
Yes, our business is ensuring that you understand.
Thank you very much, Nina and Ibrahim, speaking to us from Parliament, and they'll also be crossing over to the National Treasury to hear a briefing from the leadership of the National Treasury before that leadership then crosses over to Parliament to deliver the budget statement. We're having our mic ground today in Nakuru County, courtesy of Okoa Uchumi, and we're having a conversation with the citizens of Nakuru on matters of budget and seeking to understand education, health, and the budget itself. Does the budget actually reflect what is citizen-centered? Mariam, we're now crossing over to higher education. So we talked about the basic education.
Yeah.
You know, just touched on basic education. There's also the issue of now the post-secondary education.
Right. I think it would be a disservice if we left without discussing higher education. Got Franklin here from Egerton University. Talk to us about the new funding model, its effects, its implementation. Is it rooted like everything else? Is it a good idea but the implementation is the problem, or is it a bad idea?
Thank you, Marian. Thank you, Fixing the Nation, led by Latif. Latif, some days back you were having Jimmy Wanjigi on your show, that is Spice FM, and you said that he who has a saw in the mouth knows that blood is salty. And I want to say that on 23rd of May, the government 2023, the government introduced a new funding model that was aimed at transferring the burden from the government now to the parents and to the students. And I want to say that the idea was well, the idea was great, but the implementation is totally wrong. For example, I was having doing a little bit of research. Let's say that someone placed in band 1, you know, the bandings were based on your age, the university, the high school you attended, the marginalization, and so on. There are so many parameters. But then let me say that someone who landed in band 1 and is doing medicine course, let's take for example Moi University. The cost program there is 612,000. That is per year. And then this person is getting 70% government scholarship, loan of 25%. Then the family will pay the 5%. Then the upkeep that you get from the government is 60,000. Now, by the end of these 6 years, listen to this person and the family will be yoking. They will pay a total of 428,400 shillings, that is under government scholarship. And then the loan from the HELB, that is loan, 153,000. The family will pay 30,600 and the upkeep is 60,000. Now look at this loan burden. The total loan by the end of the 6 years, someone who is in band 1 is 1.28 million. That is a loan. Then the total family is 183,600. So the total burden for someone in band 1 is 1.46 million. Can we compare it to the old funding model, the DUC, where maybe someone may be receiving 40,000 in 6 years, it will result to a loan of 240 times 6, 240,000. No, from 240,000 all the way to 1.46. Is it fair, surely? It is not fair. Is it friendly?
For the benefit of our audience, band 1 would be you are receiving the most funding, or you're receiving...
You are receiving the most funding. You are receiving the most funding. And let me tell you, when I tell you someone, let me just read for the sake of time, someone in band 5 will walk away with a loan, will burden a loan of 2.81 million by the end of 6 years. Surely, even if you just graduate and become be absorbed in the internship, you are starting at 2.81 million.
At negative 2.8
You are starting at negative 2.18 million. Is it fair? It is not adding up. Right. One of the cheapest courses, Latif, in Kenya is arts. And someone maybe who is doing arts in Kisii University, the total burden that they will, but that is 4 years, but the total burden that they will carry is 386,808. You know, art is one of the courses that when you do, you can tarmac for a whole life. even if you can be given a lifespan of 150 years, you will just end up tarmacking. For sure, we are in Kenya. We know what Kenya is. Someone in band 4 will be getting 473,700. That is alone. So it means the bandings, they have been there maybe since 1974. The bandings have been there, but they are not sounding as they are sounding today.
Okay.
Yes.
So the issue is how we are funding our education.
Yes.
All the way from basic to post-secondary education.
Yes.
And whether our taxes are actually going into funding education, or whether we are still paying taxes and coming out of pocket to cough. And you're saying it's not balanced. Let's hear from the other student leader here, Dennis.
Dennis, yeah.
Just a minute, one.
Time, tafadhali.
Okay, thank you very much. One wise man once said that it's only a poor man who complains of a hole in his pocket. A wise man uses it to scratch his scrotum. Yes. Dennis is not here today. My name is Teddy Odhiambo. I'm a student leader at Egerton University and also the Deputy Secretary General for the Nakuru Students Governing Council. Now, the comrades at the moment are very emotional. In fact, when I went through the budget with some of my friends, we were even almost calling the CS, John Mbadi, to remove the national security allocation, which is 250 billion, and give it to us as the comrades, because we are allocating 250 billion to the national security, yet they are not maintaining our security. They are the ones who are taking the lives of the comrades, and the comrades are here suffering. Comrades Samaniaje.
In comparison,
yes, you can see the way the comrades are emotional. Now,
in comparison, yes, how much is being allocated to higher education?
Okay, higher education, we are being allocated 80 something billion, I think 80 or 81 billion, which is not enough according to me. Because, for example, if you check the costs of the various courses in our universities, the cheapest course, for example, at Egerton University is around 148,000. That is for an academic year, which these courses are very rare nowadays. Most of the courses are 400,000, 500,000. Course like medicine is 630,000. With the new university funding model, even in Band 1, like he has explained, most of the students are not benefiting from the government. For example, at the moment, most comrades in second year have very huge loans, and most of them are at a risk of deferring the education because they are not able to clear their fees. In fact, I'm very happy with the Vice Chancellors of the university for allowing the comrades to continue staying in school. But it's still not making sense that we are being allocated 80 billion. Yet I saw somewhere in the social media yesterday that there's 150 million which has been, I don't know whether it's true, but there's 150 million which has been allocated to look out or to take care of the MPs through Twitter or robbers in Twitter or the people in X. 150 million divided by 50,000 can accommodate like 3,000 comrades. That's a whole first year intake in a certain university somewhere. That can reduce their fee by 50,000. So you see, the priorities are not right. The priorities are not right. And this is something that should be improved on. And as the comrades of this republic, I think that in the near future, we have like only one cohort remaining that is in the old funding model. In the near future, we are going to have a very serious crisis in this country because most people are not going to be able to join the university if they continue with such an allocation on the education sector. Yes.
From not a capitation, from that money trickling down from the national government, how much of it actually makes its way to universities? How often, how much is supposed to make its way? Let me go to Nimo, who is the Director of Finance at Egerton University. How much is supposed to come? How much comes? How has that changed over the last year with the new funding model?
Okay, for me, nilikuwa nataka niongele something else.
Okay.
Yeah.
What did you want to speak about?
Okay, for me, you know, I'm a Muslim.
Yes.
Yeah. So, like, my question is, like, government inafanya nini ndo to include, like, kwa hii new funding model, like, to benefit peers? As for me, like, as Muslims, we are not supposed to take loans, then ziko na interest on top.
Bearing, yeah.
So, like, na hii kitu imekuwa ikitusumbua for long, yeah. Utapata like mzazi wangu like ako zile za like okay, ukiapply kitu utapewa yes, but inakuja na interest. Na hiyo interest ina affect faith yangu, unaona? Ina affect dini yangu, unaona? Yeah, so like utapata like mzazi ata prefer like pesa itoke kwa mfuko yake direct, akuje alipie fee. As train like utapata hadi mzazi labda ako na watoto wengi bado like hajakuwa like employed na like okay, labda hayuko under white collar jobs, anafanya casual work, yeah, like lakini bado ana strain,
yeah,
alipie hiyo nini fee, unaona? Yeah, ndo asipati hiyo shame ya nini,
but you're supposed to take this loan,
yeah,
for you to be able to get it. So is there a Sharia compliant version of this funding model? Sijaisikia.
How has it been? Because student loan has been there for very many years, as far back as the 70s. How was it?
Tulikuwa tuna survive na bursary before.
But the bursary was a loan from, there was also a loan from HELB.
Sasa hiyo loan, most of the students seme kama place nimetoka Garissa, like wana prefer like wasi apply your loan.
Wasi apply for help.
Yeah, wasi apply for help. Like kwanza utapata mostly wenye wako affected ni boy child. Utapata mvulana amefika hadi form 4, juzi ilikuwa free, ndio primary like high school hadi primary high school zilikuwa free, ndio utapata watasomea nini, wakifika form 4 wakimaliza utapata boy amepita kuna B+ A minor, but hata join nini campus, ataachia mtu kama sister yake mdogo aende campus ndo mzazi alipie fee, ama utapata ameachia like brother yake mdogo like hata sacrifice. Na wenye wako affected mostly ni first born, second born child, yeah. So like hiyo na hiyo bursary pia yenye walikuwa wanatupea before, juu walikuwa wanatupea bursary mingi kiasi, ilikuwa inatusaidia, but siku hizi wameanza ku reverse pia hiyo bursary. Sasa tunashindwa like tutasurvive aje.
Because the bursary you don't pay back na haina interest.
Yeah. But siku hizi pia wana reverse your bursary.
Ku reverse aje?
Like kama mimi nilipewa bursary January this year ya 100k yenye ilikuwa inaketa for first sem fee. Na hiyo 100k hadi juu first sem fee yangu ni around 160,000. But watu account walinipea 100,000. Na hiyo ni first sem pekee. Second sem, third sem mzazi ndo alikuwa anatoa kwa mfuko, unaona? So hiyo 100 yenye walinipea first sem January, ilifika March napata wame reverse. Sasa imebidi tena nimepigia mzazi atoe tena 100k kutoka kwa mfuko yake ikuja kwa fee, unaona?
Ukisema ku reverse sielewi exactly.
Like pesa imeingia kwa account ya shule ina reflect. And then like mzazi alikuja akalipia 130 ya second sem, alafu napata nimebaki na 30k kwa M-Pesa, kwa nini kwa portal. Kurudi pale kwa nini place ya finance registration, administration, venye nilifika huko aliniambia wali deduct your 100k juu 100k ya kitambo yenye iliingia imekuwa
they reversed the transaction.
Yeah.
Kuna tupe huyu madam Mike hapa.
Wacha niseme kuwa elimu sio anasa, asha kumsima tusi. Inamaanisha kuwa anasa utalipia kwa gharama, lakini elimu ni haki. Haki kwa kila mwananchi na kila Mkenya. Kwa hivyo vile dadangu hapo amesema, hata kipengele hichi cha bajeti ya 2025 kinasema kuwa bursary haijaongelelewa hapo. There is no allocation for bursary for students. And so that means that pia VAT ambayo imeongezwa, wameongea kuhusu VAT ambayo imeongezwa katika elimu. Hiyo inamaanisha nini? Hiyo inamaanisha mzazi ataenda kwa mfuko wake aongeze bidii sana ili aweze kupeleka mtoto katika chuo kikuu. Inamaanisha kuwa chuo kikuu ni kimetengewa tu matajiri. That's basically what that means. Asante.
All right. Thank you. Nona, one more comment hapa as we wrap up the conversation. Tumpe huyu gentleman ambaye akingojea sana.
Hello. My name is Ben Karanja. I am a resident at Bahati. Mine is to speak on the quality of education. Now, in this room, we have doctors, we have teachers. Is it the quality of education? Is it research-based? What will be the gap that we'll be needing maybe in 2027? Because we can't be training more teachers, more doctors, and they can't be absorbed. Yeah. So maybe have a plan, have a research-based plan, so that if at all you're investing in education, if at all you're investing in health, let our youths, after wamemaliza kusoma, they have somewhere they are going to. Let it be more research-based. Speaking on the funding model, I don't understand how during Kibaki's era, the budget wasn't even 1 trillion, but really we afforded free primary and secondary education. Now we are at 4-point-something trillion, and we still can't afford primary and secondary education. So that's is it that they are budgeting for more corruption or what's happening? Yeah, thank you.
Alex, just clarify on some issues because you've studied the budget as well, and the proposals in the budget. Is there a reduction or withdrawal of university bursaries?
Thank you, Ratif. If you look at the current budget, one of the sectors that has enjoyed an increment is the education sector. But the increment is quite interesting because we have an increase in university bursaries of about 14%. However, in the same sector, you have a reduction at the basic education of about 12.7%. 12.7 billion. But focusing on higher education, what we are seeing is an increase in the bursary of about 14%.
So it's actually going up?
Yes, for the university funding, that is the bursaries that they get through HELP is going up by 14%. But that does not mean it's enough. That is where the challenge is. And I think even the Cabinet Secretary yesterday clarified that though 28% of the budget is going to education, it is still not enough. I think the entire sector has a funding gap of about 108 billion.
Do we get the value for all these billions? That 700 billion shillings goes into education. Do we get value for that anyway?
Well, if you look at the 700 billion, a bulk of that money actually goes to payment of salaries. Looking at just teachers, primary and high school teachers only, I think they are around 400,000, and they eat up about half of that amount. Then the other amount will go into capitation, and then you have a bit of it going to infrastructure. So it is not enough. And if you look at even the BPS, the requirement for the education sector would have been somewhere in the neighborhood of 900 billion. So having allocated 700 billion is a good effort because it's 28% of the budget, but we still have a huge gap. That is why the students are complaining about the funding model. And I think the bigger challenge is the fact that the burden that the household is going to have, which is high, and then the part that is loan, that is what the student has just explained, is also very high. Because when you're getting into the job market and you already have a loan component of $1 million plus, then you are starting in a very serious negative.
Hi, we're wrapping up the conversation now, guys. Sorry, we are absolutely out of time. But as we think of the fixes for this year, this budget, healthcare, education, what would you say? Just one person, 30 seconds, one fix. 30 seconds, one, these are the first two hands to go up and they haven't spoken, so I'll have them. 30 seconds, 30 seconds. Fixes for health, for education, 30 seconds.
My name is Alvin Kisara, and this is my fix. Most of the time unasikianga member of parliament wanajiongezea mshahara, na wakisema wajiongezea mshahara, mimi sisikizangi wakisema ati mshahara pesa hayuko kujiongezea mshahara. But in this case, ndugu yangu hapa nimefurahi vile amesema like out of 700 billion plus, more than half of it inaenda kulipa walimu, maintenance nini. So if, in real sense, like the funding doesn't even be the logic. So my fix would be to reduce pesa zao civil servants. At some point I was checking the allowances and salaries around that were being paid for civil servants for a whole year. It could cater for Kenya to build SGR bila deni yoyote. So these civil servants, they are being paid a lot of money, which is very, very unnecessary. Mbona unakuja mali na kukana kudictate mshahara wako na suppose kuongezwa na when you are a public servant. There may be reasons as to why we are supposed to, maybe wana supposed kuongezwa mshahara, but so far hatujapata reason ya wao kuongezwa mshahara.
So cut public wage bill.
Okay. My name is Webster. I'm from Tribeless Youth, and I feel the way we can fix this nation is by stopping the politics. Let us stop politicizing everything. When we were devolving this nation, there were factors that was not supposed to be devolved because they ended up to more devolved corruption. like health and education. These are not things that are supposed to be politicized. Hatufai kuwa tuna negotiate about health. We need policies and structures that, regardless of the regime that is in power, regardless of who you voted, regardless of where you are in this nation, you deserve quality health care because you pay for it. The money is there, and you deserve quality education because we pay for it. Thank you.
Last, Rono, as we wrap up, just your parting shots.
Great. So the conversation has been real, and I think we have heard even from our guests here today. One of my fixes, and I'm a big supporter of devolution, because devolution has come to change. As much as we say that it devolved corruption, but we have seen greater improvements. So for me, one of the things that I'll be looking forward, and I still champion, is that we increase the allocations to counties, because the allocations then mean we are going to have better service deliveries, which could be health. So right now, the allocations to the counties stuck at 4 or 5. The Senate is proposing 465. Then if we increase to that, then that means also we'll be able to trickle down more resources. That means we'll be able to get more medicine to the facilities, meaning that we'll be able to get more infrastructure at the county level. So that's my first fix. The second fix is that let the government use data. Because now, if we use data, if we could hear what the students are saying about the loan, that's a research, that's a data. If we could determine, for example, we look at the issues of water within our hub, and we rely so much on data because we see the areas like Samburu has 26% of water, households accessing water. Then what does that mean for that particular county? That means we have to invest more. So going forward is, as a country, we need to have our priorities right, and the priorities needs to be backed up with data.
Asante sana. Peter Rono, Budget Facilitator, Rift Valley Budget Hub. Alex Reithi, Head of Programs at the Institute for Social Accountability. Our partners at Ukao Uchumi, and our residents, students, leaders, teachers, Wazewa Kijiji, everybody from Nakuru County who's been able to join us today. Asanteni sana. We will be monitoring, of course, what John Buddy will be saying in the National Assembly today. Tomorrow, we'll still be here. Mike Kwa Ground will still be in Nakuru County. We'll be discussing other issues that affect the citizens of Nakuru and what also works and doesn't work in Nakuru County. But thank you for tuning in. Fixing the Nation, one conversation at a time. It's been Eric Latif, Mariam Bishar from Nakuru County. Keep it here for more on NTV. Tomorrow, we'll still be back here in Nakuru. Good morning. Audience.